Okay, we're going to get started. This is our week 5 presentation. Let me do a quick screen share. So this week is nice and short and sweet. So we are going to talk about the bunny line. We're going to go over the chemical peels and then some common AR errors, and then we have our marketing homework for the week. So the very first thing that we're going to talk about are the bunny lines. So the bunny lines are caused from the nasalis muscle that wrap around the bridge of the nose. They can also be caused by the very bottom part of procerus, of where it actually connects to the bone. And so that little connection, whenever you activate procerus, can actually cause a little bit of a crease, and it's the bottom part, and we can refer to it as a bunny line. It's not caused by nasalis like the other ones, but it is something that a lot of patients want us to go ahead and knock out. You treat it like a small muscle group. So it is 2.5 fluid units into each injection point, and it's very simple to treat. Whenever I'm treating the bunny lines, I always try to treat it with the patient in contraction because it gives you a little bit more tissue to work with. So I'll have the patient kind of crunch their nose a little bit, and then you can mark in contraction. And then also that's one of the only ones that I will inject in contraction as well. Again, just because it tends to be a little more comfortable for the patient and it gives you a little bit more tissue to work with. Let's see if my link will work. So you can see how she's treating these. So she's crinkling up her nose and going just right on the side. And again, it's going to be 2.5 fluid units into each injection point, and it will soften the nasalis muscle, and that's what we're going to be treating. Very simple procedure. Any questions on the nasalis or bunny lines? Perfect. All right. Okay. So now what we're going to go over is the perfect derma peel. So after this call, you are officially able to start ordering the perfect derma peel and start offering it to your patients. But first, we have to watch a quick training video from the manufacturer. So hold it. Give me 1 second. I need to screen share a different way. Here we go.
Welcome to the Bella Medical
Go
Products
ahead and give me a
training
thumbs up
video.
if y'all can hear that.
In this video presentation, you will meet some of our corporate staff, receive additional product information, hear testimonials, and view demonstrations of the Perfect Derma Peel application. Founded in 2011, Bella Medical Products is dedicated to formulating innovative, result-oriented skin solutions for the aesthetic medical industry. Ranked as one of the top 3 new anti-aging products of 2011 by ABC News, the Perfect Derma Peel delivers healthy, ageless skin for all skin types and ethnicities. Bella Medical Products advocates the practice of less invasive cosmetic treatments by providing cutting-edge products to plastic surgeons, dermatologists, cosmetic physicians, and other medical professionals. The Perfect Derma Peel and the Perfect Skincare System product line allow us to offer an exciting new future for skin transformation.
The Perfect Derma Peel is my go-to peel for all of my clients because of its versatility for all skin types and skin issues. I love how the Perfect Derma Peel has little discomfort, and with such little downtime, the results are dramatic.
My clients have benefited from the Perfect Derma Peel for several years now. Applying the Perfect Derma Peel is very easy, and our patients are thrilled with the results.
The Perfect Derma Peel by Bella Medical Products is committed to providing skincare products that deliver superior results to the aesthetic medical community. The Perfect Derma Peel is a safe and effective treatment for aging skin and is the only peel to feature glutathione, an antioxidant with powerful anti-aging benefits. The Perfect Derma Peel is available throughout the U.S. and is growing in popularity worldwide.
Hi, my name is Lana Petrovic. I'm the Director of Operations for Bella Medical Products, and I'm going to explain to you some of the benefits of the Perfect Derma Peel. The Perfect Derma Peel will improve the overall clarity, tone, and texture of the skin, reduce or eliminate hyperpigmentation and melasma, control acne, remove or reduce sun damage, soften fine lines and wrinkles, and minimize the appearance of pores. The Perfect Derma Peel is beneficial for all skin types and all ethnicities.
I feel very comfortable using the Perfect Derma Peel because it's very safe, and at the same time it's very, very effective, very result oriented.
The Perfect Derma Peel is one of the easiest peels I've ever performed. I've been giving peels for 20 plus years in this business. It's 1, 2, 3 easy. It's a half-hour process. They're fairly comfortable throughout the entire procedure. It's great. They're up, they're gone, they're fine. They absolutely love the result. It's a great thing to do when you're preparing to go on a vacation or a wedding. Anytime you want your skin just to look flawless, they absolutely love the Perfect Derma Peel.
Hi, I'm Michelle Ray with Bella Medical Products. The Perfect Derma Peel is a medium-depth medical-grade peel featuring a unique blend of acids that address many common skin concerns. The peel contains TCA, retinoic, salicylic, and kojic acids, phenol, vitamin C, and antioxidant glutathione. Each acid is under 12%, and the peel is pre-mixed for easy application.
I really enjoy working with Bella Medical because the customer service is amazing. I mean, I've never had any issues. It arrives on time, the product is consistent, and they're really easy to work with.
I am Nafis Sabai, the founder and CEO of Bella Medical Products. We are committed to providing skincare products that deliver superior results to the aesthetic medical industry. We are happy to welcome you as a provider of the Perfect Derma Peel.
Hello, my name is Juliana Wagner. I am a licensed esthetician of 20 years, and I'm also the senior trainer for Bella Medical Products, and we're here to do the Perfect Derma Peel today. So Natalie has concerns with fine lines and wrinkles, so we're going to do the Perfect Derma Peel on her today to bring back that healthy glow to the skin. So what we prep the skin with prior to the peel is 100% pure acetone. It degreases the skin so that the peel gets down into the skin evenly and deeper into the skin as well. I'm going to have you hold your breath and tuck your lips, please. Any areas of concern, such as fine lines and wrinkles, as well as hyperpigmented spots, deeper lines, you want to be more aggressive with your acetone in those areas, again, to get that peel down in there to do a better job. A good 2 to 3 passes is necessary. Next, we're going to go ahead and put the peel into the cup here. And you're going to want to apply it with one of the 2x2s that come with the peel. And you're going to fold it into a little bit of the square. In our first pass, we're going to go lightly just to numb the skin. How are you feeling, Natalie?
I'm good.
Good. So the active ingredients in the Perfect Derma Peel is the TCA, salicylic, retinoic acid, vitamin C, glutathione, kojic acid,
It's kind of typical now.
and with the phenol in there, you don't have to have the pain. We're going to feather into the neck 1 to 2 layers, and directly underneath the eye 1 to 2 layers as well. I'm going to have you look up towards me, please. And go ahead and close and relax. You're going to layer the peel till it's gone. You're going to look for frosting as your end point, as well as erythema. You want to redip often into the cup so that it stays nice and even throughout the peel. Maybe look up towards me, please. And that'll be the last layer underneath the eye as well into the neck. And then we'll finish the peel throughout the rest of the face. Almost done here. And you just want to work it through once your cup is empty till your gauze is practically dry. And that's it. As simple as that. So next, we're going to go ahead and go over the post-peel kit with Natalie. Natalie, the peel is supposed to be left on in 6 hours. It self-neutralizes. So you can wash your skin in 6 hours, but preferably I'd like you to go ahead and leave it on overnight if you're not uncomfortable in any way. In the morning, I'll have you wash with a very mild cleanser, and then you're going to go ahead and I'm going to recommend that you take one of the 2 towelettes that are in your post kit. I'm going to hand you the directions as well. And this is a towelette that you're going to use on clean, dry skin tomorrow morning. And this has vitamin A, so it's going to help to expedite the peeling process. So we'll go ahead and you'll use the towelette fairly aggressively. You're going to rub throughout, make sure you get under the eyes really well, and also feather it into the neck. You're going to go ahead and wait at least 30 minutes before applying any sunblock on top. And then you're free to wear makeup that day if you choose. Then that evening, I'm going to have you go ahead and I'm going to have you cleanse again with something mild again. And then go ahead and use your second towelette. And again, very aggressively, you want to rub it throughout the face, feather it into the neck and under the eyes, and then just go ahead and sleep with that on overnight. Okay? Then after that, the next day you're going to start to see that you're going to start to peel around the mouth. And that's where we talk and move our skin the most, so it'll peel first. And then it's going to kind of just slowly peel out for you. So during that process, you're going to use the hydrocortisone 1% cream that's in the kit as well. And that's all you'll need along with your sunblock. Okay, and then it is a 7-day process, and then you're going to just look beautiful and glowing as you naturally are.
Thank you so much.
All right, thank you. Prior to the application of the Perfect Derma Peel, it's important to go over the contraindications with your patients. Contraindications include pregnancy, breastfeeding, Accutane use within the last 12 months, hypersensitivity to any of the peel ingredients, or aspirin allergy. Do not apply to skin that is still irritated from any harsh treatments such as lasers, waxing, electrolysis, or chemical exfoliants. Do not apply to open wounds, sunburn, infected skin, cold sores, herpes, or lesions. It is important to advise patients with a history of cold sores to be given an antiviral prior to the peel. For overall rejuvenation, we recommend doing the peel no more than 2 to 4 times per year. However, for chronic conditions such as acne, hyperpigmentation, melasma, and concerns with fine lines and wrinkles, we do recommend a series of 3 peels 30 days apart. For thicker and more resilient skin types, melasma, and acne scarring, we recommend adding the Perfect Derma Plus Booster to the peel solution for optimal results. The peeling process will vary per person based on skin type and skin condition. The peeling process will start within 48 hours, intense peeling for 2 to 3 days, and an additional 2 days remaining with the residual around the hairline and neck areas.
If you have any additional questions or need more information, please feel free to contact your local sales rep or our corporate headquarters.
Okay, does anyone have any questions regarding the Perfect Derma Peel? Perfect Derma Peel.
I do.
Yep.
So if they ever ask, because I know the upper chest can sometimes get sun damage as well, but I know we're only supposed to feather it down to the neck. Do they ever ask you if it's appropriate to do it on that upper chest area?
Absolutely, like the décolleté area, 100%.
Yeah.
Yep, and that
Okay,
makes a
so
really big difference because like women, we age really profoundly there.
so then if they're getting one peel, we would just spread that cup like down there.
Yep, correct. You're only going to be able to do probably 2 passes instead of the 3, if you're going to add, kind of more square footage in the chest.
Right. Okay, thanks.
Yep,
Can you also do that with like the upper back?
correct. I do it for my daughter's acne in her back.
Great.
Yep, it makes a really big difference with acne scars.
Okay.
So just be careful afterwards because it's like baby skin. So please make sure you wear sunscreen.
Gotcha.
All right. Okay. The next thing that we're going to talk about is an aesthetic record. It talks about the variant versus the tier. Now, kind of a spoiler alert, this is going to be kind of going away. We're going to talk about it on Monday, but we're going to be getting rid of the tiered system. But what we are going to be having for Daxify for everybody is the per area. And so you can charge per area or per unit. Some people like the per area because it's just a flat rate pricing, where other people, they would just want to do charge by unit. So we're going to kind of leave that up to you. The only other variant that a patient would be able to choose from is if they are a VIP. So if they're a VIP, then you would automatically choose the VIP tier. So please make sure you do that. But again, that pricing and those kind of special announcements will be coming out on Monday. All right, let's talk about the homework for the week. So this is kind of a big ask this week. We want you to join a networking group, and it can be an online networking group. It can be, I'm joining a neighborhood page. I'm joining a bunko group. I'm joining a gym. I'm doing one of those kind of women entrepreneur groups, whatever you want to do, whichever fits your personality best. We're trying to get you comfortable with being uncomfortable and out of your warm market and starting to reach out into that cold market and really get yourself out there so you can start marketing. And then you're also going to post a before and after of the chemical peel. Again, I have that graphic for you, so I will post it on the Facebook page. And then you're also going to do one post about an education post on the benefits of a chemical peel. And this can be really anything that you want it to say. It can be about how frequently you are doing it, what can happen, what are the potential effects of getting a chemical peel, what are some of the do's and don'ts after getting a chemical peel, all those kind of things. And then you're going to continue your social media following. The first 2, they are additional educators that I want you to follow. The very last one, it's actually a podcaster. She died now, I guess now, probably about a year ago or so, but she is excellent. She was excellent. She was so motivating. She was more geared towards multi-level marketing, but she's just so great at talking about how you can run your own business and how to motivate yourself and just gives you tips and tricks of how to put yourself out there. So I highly recommend Jessie Lee. Now, she does cuss a lot in it, so just be mentally prepared for that. But she was a very fun person, very bright human. The world definitely lost a superstar when she passed away, but she was very fun to listen to and she was definitely motivating to me. And so I want to pass her on to y'all. So that is it for this week. What questions do y'all have for the rest of this call? Anything that I can help y'all with?
All right, I have a question. You're probably not surprised. It's me again. Okay, so back to the for the Botox. So for example, my mom, I may have mentioned this to you, or maybe it was Shelly, but she says that whoever she goes to, she typically says, okay, this is however much I can afford right now. It's usually like 30 units or so. And she says that they will spread it out like from her glabella and her frontalis. But I'm wondering, how do we do that? Because I know it's the way it's recommended is that when we inject the frontalis, we have to do the glabella as well so that there's no drooping and that sort of thing. So if they're asking for less, then how would you spread that or divide that?
Yeah. So anytime that a patient says they're on a budget or they're, wanting less units, we absolutely can do that for them. You just need to educate them that they are still going to have some movement. And if they need any touch-ups afterwards, it's not covered. They have to pay for the additional units because they're not going based off of what is the typical recommended units. You are decreasing it based off of budget. So what I would do if a patient says I can only, do 30 units, and that's typically what I do, I would probably do 2, 2, 2 instead of the 4 right here. So 2, 4, 6. So normally it's 4, 4, 4, right? For Botox. So it would be two. I would do 2, 2, 2, basically half dosing in the glabella just to kind of help hold it up, and then you can scatter the rest in their forehead.
Okay, awesome. Thank you.
Yeah, and just know that she will still have movement there, so just educate her on that. And as long as she's okay with that, then that's totally fine. But if she comes back 2 weeks later, says, "Hey, I'm still moving a lot," it's like, okay, well, we did half dosing, so that's the reason why.
Right. Okay, gotcha.
Yep. Did that answer your question?
Yes, absolutely.
Perfect. All righty. Well, I hope you have a great rest of your weekend. I know the 4th is officially over, but you have a few more hours left just to kind of enjoy the rest of the weekend. But I will see everyone on Monday on our big announcement call. I will catch all of y'all then. Bye, guys.
Can't wait. See you
Bye.
later.
Oh,
Bye.
thank you.